And good evening, everyone, and welcome to the Your Health is Important radio broadcast, the only interactive healthcare forum that allows you, the listener, to call in and ask your healthcare questions. So you can tune in right now. We are live on Facebook. Type your questions in, and we'll be happy to answer on any healthcare topic. I'm your host, Dr. MJ Collier, and we're here live right now. Facebook live. Let's do it. It's showtime. Okay, ladies and gentlemen, greetings and thank you so much for sharing your evening with us. We know that this is a time that is very precious. It's family time. It's time where you're getting off of work and trying to relax. So we appreciate you taking the time to join us here on this Facebook Live version of Your Health is Important. So our question and answer session is going to be beginning. Thank you, RZ Miller, Riz Little. Hello from Memphis, Tennessee. Thank you so much for tuning in. We greatly appreciate each and every one. And remember, when you put your questions up, tell me who you are and where you're signing in from. Darlene Rogers Heath, hello from Orlando. Great picture. Audrey, Shanae, and Galu from Nolens. Thank you so very much. Going to check on the family there after that hurricane. So thank you so much. Keep doing the things that you're doing. A wonderful woman. Kimberly Williams. Hello, Kim. Thank you so much for tuning in. We greatly appreciate you and all the individuals. We're going to acknowledge everybody. Jerry Mitchell. Hello from Shreveport, Louisiana. I love Shreveport. I used to go to Shreveport to give lectures on a quarterly basis for years. And so thank you so very much. Didn't know that they had casinos in Shreveport until I found out, and great seafood. Tamika C. Evans. Hello from Virginia. So glad to have you tuning in as well. And so, as you know, we are the medical consultant for the Ricky Smiley Morning Show, and we are on every morning to give you information about your health. The predominant healthcare topic, of course, is the coronavirus. And the question is, to boost or not to boost? That is the question. Well, Dr. Collier told you during the last broadcast that they were discussing giving booster shots, and there was literally no clinical or scientific reason to do so. Now, at this point, the president announced that they were going to start boosters on September the 20th. The CDC, the Centers for Disease Control, and the FDA, the Food and Drug Administration, both pushed back. Other local scientists and physicians such as myself pushed back, saying there was no reason for us to start giving booster shots to people when there was no decrease in efficacy with the coronavirus vaccines. As you know, there are 3 vaccines that are currently available in the United States. That's the Pfizer, the Moderna, which are both mRNA vaccines that are 2-dose required, one in 21 days and one in 28 days, so 3 or 4 weeks apart. The third is the Johnson & Johnson single-dose vaccine. It is an adenovirus vaccine, and it works by a different mechanism, and it also has shown great efficacy against the coronavirus and particularly the Delta variant. Now, so there was research done, some in the United States, some around the world, in reference to what happens if you get a booster shot. Well, getting a booster shot can increase your antibody count by 300, 400%, sometimes in some cases 1,000%. But the point is and continues to be how much antibody coverage is enough, as well as there are other mechanisms as far as the immune system is concerned to protect you from not just coronaviruses, but anytime you get a vaccine of any type. Well, there's what's called memory cells or B cells that when you are exposed to that particular pathogen, such as the coronavirus, it kicks out immediately within literally minutes more antibodies to protect you from that. Whereas if you just took a passive sample of antibodies, the antibody count may be low or even unmeasurable. But once exposed, it kicks out. Then there are things called T killer cells. This is a different type of cell and different from the antibody proper, but it also is very, very important as part of the immune process. So those things continue to work and function just fine. Again, the science of immunology has not changed and will not change in my practice lifetime. So it's important to embrace, one, the need for the vaccine, but two, understand that the vaccines are good, the vaccines are working, the vaccines are protecting you, and literally there's just no reason to get a vaccine at this point. Now, there's a caveat to that. For individuals that have immune system dysfunction or they're immune compromised in some form or fashion, possibly due to something, say, like chemotherapy for cancer or immune therapy for autoimmune diseases such as lupus, if you've had an organ transplant and you're on continuous immunosuppressive drugs, then when you got the vaccine, you might not have built the type of immunity that a person with a normal functioning immune system would have built. So I advocate and promote, and this is what the CDC is recommending, that individuals that are immune compromised, those individuals that have received a solid organ transplant, such as a kidney, a heart, a lung, then those individuals need to get booster shots. If you are immune compromised by HIV disease and your T cells are not measurable or too low, then you need a booster shot. But the treatments for HIV right now are so good that you can decrease the count of the amount of virus in your body to a point that it cannot be measured, and it's like you're living with HIV, but it's like not having HIV. So that is where we want to be with this coronavirus. And several HIV drugs are actually being utilized because their mechanism of action would also stop the replication of the coronavirus in our bodies, just as if they stop the replication of the HIV virus in our bodies. So it's okay to utilize some of those medications, and some of the treatment regimens do include those. They are looking for oral therapies that can give intervention. In other words, they can treat an active infection. So right now, there's a remdesivir, which is an HIV drug, and there are the infusions of artificial antibodies, the antibody cocktails. There's one product with one antibody, there's one with two, and one with three. All of those can be infused, and they're actually looking at also just giving you those as an injection without an infusion. We're looking at very creative ways and learning a lot about the treatment of viral illnesses with this coronavirus. So medicine has been bumped ahead 50 to 100 years because previously you didn't treat viruses. We had no way to treat viruses. Recently, in my practice lifetime, they have developed the ability to treat and cure viral illnesses such as hepatitis C. For a week course of therapy, and you are cured of hepatitis C. They can control viral illnesses such as HIV. And so now we're looking at ways to definitively treat a viral infection just as we would treat a bacterial infection with an antibiotic. So they're looking at pills that can do that. Again, they are looking at a couple of drugs that are utilized right now to treat HIV. They're looking to create new molecules that can do that. So to boost or not to boost, if you don't meet that criteria, you probably don't need a booster shot. There are variations in the vaccines. The Moderna vaccine is the most potent molecule. It gives you a higher percentage of antibodies when you receive it. It's twice as potent as the as the Pfizer vaccine, which both are effective, but the Moderna is just more potent. So if the efficacy and the amount of antibodies that have been found in the Moderna vaccine patients has decreased from 95% to 85%. Whereas in the Pfizer immune patients, it has decreased from 95% to 42.8%. This is the data that was presented to get people to get booster shots. But even though it's decreased to 42.8%, again, take into consideration the B cell and the memory T cells, or the memory B cells and the killer T cells that are part of the immune response that will help you get through this coronavirus. In addition, don't stop doing the common sense things such as social distancing and wearing masks, particularly if you are in a crowded area indoors, regardless of your vaccination status. But again, if you're in a small group and everybody's been vaccinated, you probably don't need to wear a mask. It just doesn't make any scientific sense to do so. If you're in your family organization, unless you have children that are of age or too young to be able to receive the coronavirus vaccine, i.e. under 12 years old, then they are at risk from you giving it to them. And the way people ask the question, Dr. Collier, how do I protect my children that are too young to get the vaccine? You protect your children by only exposing them to individuals that have gotten the vaccine. That would be in your home, that would be in either school system, and that means teachers, principals, administrators, janitors, kitchen aides at the school, bus drivers. Anybody that your child will come into contact with needs to be vaccinated, particularly if the child is younger than middle school age and cannot get the vaccine as of now. The other question people ask, Dr. Collier, when will children be able to get the vaccine? The original proposal was that he'd be able to get vaccinated by January. That process is being speeded up, not inappropriately. They're just doing the research faster, so to speak. And we know that it is relatively safe in adults, so it ought to be relatively safe in children as well. The things they're trying to figure out is the dose. In other words, most pediatric patients under 12 will probably receive a dose that's one half that of the adult dose. Over how many shots, 2 or 3 probably. So we're going to that's being figured out in real time, and it's thought that maybe we might be able to get them as early as November, middle or late November. But with the flu season coming on right now, and everybody having being exposed to the flu vaccine is available. Go out and get your flu shots as well. Do not get the flu shot within 2 weeks of getting the coronavirus vaccine. So if you got your coronavirus vaccine 6 months ago, then you're fine. You can get the flu shot now and you'll be good. But if you need to get both of them, my priority would be get the coronavirus vaccine first. And then 2 weeks after that, after your second shot for the 2-dose regimens, and after your first shot with the Johnson & Johnson, you should be able to get the flu vaccine with no risk of problems. There's not been shown any problems in getting both of those shots on the same exact day, but it's just being recommended that people take 2 weeks apart because we don't want any confusion with some of the potential side effects or, something that's been undetermined at this point when getting them. Just the recommendation, 2 weeks apart, that makes a good common sense. There's no scientific reason to do so, but sometimes common sense trumps scientific knowledge because we are learning every day in every way about this coronavirus. It is teaching us so much. And oftentimes you will have an opinion or a recommendation early on in the process. I remember when the recommendation was you did not need to wear a mask. I said then that common sense shows that you should wear a mask. Mask would be a reasonable thing to do. Also, don't just protect your nose and your mouth because your eyes are a nidus of infection. So if someone coughs or sneezes in your face and your eyes are open, you're going to receive the coronavirus vaccine, and there are receptors on the cornea of the eye. And every time you blink, those tears carry that coronavirus directly down your tear ducts into your sinuses. So the tear ducts are here, goes down your tear ducts into your sinuses. You could not ask for a better inoculation mechanism. So you need to wear goggles. You need to wear goggles that cover your eyes fully, like this. You can get these at any hardware store. You can get them at the Orange Place that rhymes with Loan, EPO, and then you can go to O's, rhymes with. So those types of places, any place that sells hardware has these. I think these were maybe $2 a pair, and they're very, very effective in protecting your eyes because they cover the sides and there's no gap. Regular glasses do a decent job, but there's a lot of gapping around high fashion glasses. So you need gargle style glasses that kind of look like the sunglasses that you wear when you're sporty. So these are very, very effective. And a mask. This is an N95 mask here that covers your nose and your mouth. Your nose and your mouth. Do not wear your mask under your chin. That is totally completely ineffective. I see people walking around that way. Do not take your mask off and let it dangle from your ear like this. This contaminates anything. So if you're not wearing it, take it off, fold it, stuff it in your pocket, keep it away. When you remove it, also don't touch the front of the mask. Put it back on safely. Make sure that you close the metal and get a good seal around your nose. And if you're wearing goggles like this, put your mask on first. Then put on your goggles on top of that. And that way your goggles or your glasses will not fog. I see people put their glasses on under the mask, and the first breath that they take, their glasses fog, and then they take the glasses off, which is removing the protection. Plus, if you need glasses, you can't see. So appropriate ways to wear your mask, appropriate ways, get you some of these. You can buy packets of 10 of these for like less than $20. Oftentimes on sale or with coupons, less than 10. So or go on the internet, Google goggle type glasses and just order some. They'll come directly to your house, but make sure that you're wearing them because they protect you, and it's very important that you do so. Those are the two key important elements, much more effective than wearing gloves. Gloves are a waste of time and not really necessary. Contact surfacing and wiping everything down with Clorox is just not shown to decrease unless you're in a condition where you have a sick person in your home. then contact surfacing. But for regular people under normal circumstances, contact surfacing is not going to really prevent it because it's not carried or passed by via hard surfaces or soft surfaces for that matter, or any surface for that matter. This is a respiratory virus. It is in the air. Someone coughs or sneezes in the air, a cloud can linger in the air for an extended period of time, for minutes, sometimes hours. And you walk through that cloud, you can be infected, particularly if your eyes are open and you're not wearing a mask. So if you are not vaccinated, please get vaccinated. There's just no reason not to get vaccinated. The logic is get vaccinated. If you have any questions or concerns about why you're not getting vaccinated, please type that in because we'd like to discuss it. I'm not trying to change anybody's mind. I'm just trying to give you real information and dispel some of the mythology that you're seeing on the internet. This misinformation is causing people to make the wrong choices. The number of people that died from the coronavirus doubled in August versus that of July. We are now over 40 million people dead with the coronavirus in the United States. In the U.S., we have the highest number of deaths of any country in the world. That includes third world nations, as we like to call them, places that have no real medical care, people that have minimal hospital care, minimal number of health professionals, no doctors, no nurses, etc. They're doing better than we are in the United States because in the United States, we have people that are mask, anti-vaxxers and don't want to wear masks. And so they're not doing that. You look in other countries, you see everybody wearing masks under normal circumstances almost, particularly in China. People have been wearing masks there because of the poor quality of air for the last decade. And amazingly enough, they are doing quite well. And they have some of the lowest rates of flu and coronavirus being passed around as we go. So that's what I'm going to tell you now about the coronavirus. Let's go to the questions. Antonio, let's load them up. If purchase the Lipo Max Pack, when should I start seeing weight loss? You should start seeing weight loss within the first week. The most people that buy that pack will lose 3 to 5 pounds per week. So don't weigh yourself on a daily basis because your weight will fluctuate. Pick a day and the same time of day. Let's say Friday or Saturday when you're not impeded or rushed. Take a unclothed weight, a naked weight at the same time of day because your weight will fluctuate during the daytime. So if it's when you wake up in the morning, empty your bowel, empty your bladder, step on the scale in your birthday suit and weigh yourself. And weigh yourself consistently the same time once per week. And you will notice weight loss. And that's the way you should do it. There are people that will weigh themselves, go work out for 15 minutes and come back and weigh themselves and are shocked and amazed that they have not dropped 5 pounds because they worked out for 15 minutes. You do not lose weight in the gym. You become fit in the gym. You lose weight in the kitchen and by altering your metabolism. So your relationship with food is the key component for weight loss. How you eat, how much you eat, and how your body metabolizes that food. That is what the lipo products do. They alter your metabolism to efficiently metabolize food, stop you from absorbing calories, and more importantly, stop you from turning calories into fat and storing that fat in your body as energy. We want you to use other things as energy or use that fat as energy immediately and not let it be stored so that you'll have a good, healthy metabolism and a good body shape with good muscle definition. All right. Should I continue taking probiotics after I finish my antibiotics? My stomach is hurting. Hello from Mississippi. Yes, I take probiotics on a daily basis. And I just make sure that when you take them, once you're taking them in that manner, once you finish the antibiotics, you can take them with food, a meal. You can take them once a day if you like. You can stop for a while or alternate probiotic tablets or capsules with yogurt. Any Greek style yogurt or the Activia brand are very high in the good bacteria or the probiotics, and you can mix it up. I do that. The problem is if you want to eat yogurt all the time, yogurt cups take up a substantial amount of refrigerated space. So you might want to buy, 10. And oftentimes, a lot of the grocery stores will have 10 for 10. So you can get 10 for $10, but you don't want to get 20 unless you just have an extremely large refrigerator. So it becomes a practical matter of not being able to store it. So I will buy 10 at a time, which you usually get me through at least a week, sometimes 2. and alternate that with the oral probiotic tablets rather, and or capsules, and take them and mix it up. But I try to keep the probiotics in the gut. You will find that it helps tremendously with allergy symptoms, sinus congestion, sinus drainage, eczema. Your digestive is amazingly better. When you have a bowel movement, it does not smell as foul. It should be larger and easier to pass, and you're just getting all those toxins out of your body. So probiotics are amazing. I recommend them. I take them on a daily basis myself, and everything from trying to keep your skin clear from adult acne to again, just the way that you smell when you perspire, and the way that you smell in your groin and your private parts. All of that changes and improves with probiotic therapy, because you have good bacteria replacing bad bacteria in your body. The bad bacteria are called anaerobes. Those are the ones that give you foul smells. So you want to get as many aerobes or good bacteria to replace that space in your gut in particular. Oftentimes when you have foul breath, it's not because of your teeth in your mouth, it's because of what's inside your gut. Your gut, your stomach, your intestine is one long tube from your mouth, esophagus, your stomach, your small intestines, your large intestines, your sigmoid colon, and your rectum. It's all one long space. So if you get foul smelling food, bad bacteria, any place, that smell just comes through the tube and eventually gets to your mouth and your nose. And sometimes you can even smell it yourself. And you say, oh my goodness, my breath smells horrible. And it's not. You can brush your teeth, you can gargle, nothing changes. You still have that. So probiotics will help with that tremendously. One of those things I endorse. Okay. Keisha Peaks, exactly what is heart palpitations, from Atlanta, Georgia? Well, your heart has an innate rhythm, kind of like a drum beat. As a black person, you got that rhythm, and you know how to do the wobbling electric slide and stay on beat like everybody else. It's amazing how we can do that as a people. So when you have a normal beat, steady beat, your mind blocks it out. You're not even aware of what's going on with your heart. If your heart misses a beat or gets into a different rhythm, you become acutely aware of it. You're like, oh, something's going on in my chest. I can feel it. And oftentimes when that happens, your heart rhythm is just resetting. Everybody has that phenomenon. It happens more often than not, particularly when you lie down and change postures. You become aware of your heartbeat. At night, when you're in a dark, quiet room and nothing else is distracting you, you may become acutely aware of your heartbeat. Sometimes the sound comes up through your arteries like a string in a can when you're making those little children's speaking apparatus. You can do that. You can hear it, particularly if you're older and you have hardening of the arteries, cholesterol plaquing in your arteries. So once you become aware of it, it's hard to ignore it. Your mind, you try to block it out, and all you can think about is your heartbeat. So when you are aware that the rhythm is irregular, it gets your attention. You kick out epinephrine now, your stress hormone comes out, and your heart may beat even more irregularly. So that's what happens with palpitations. The vast majority of the time, palpitations are a natural/normal phenomena. It's your heartbeat resetting. Is rarely a problem, so you don't have to worry about it. If you have palpitations, which is what happens, your heart should beat like this. When it beats like that, it should push out at least 50% of the blood that's in your heartbeat. But if your heart is palpitating and it's not pumping efficiently, then you don't get enough blood. First thing that happens is you get lightheaded and or dizzy. Your body tells yourself your brain is not getting enough blood or oxygen, so it wants you to fall down or pass out to get your head down so blood can passively flow that way. Well, that happens. When that happens, that's a different phenomenon, because you can have palpitations, you can have what's called atrial fibrillation, you can have ventricular arrhythmias as well. That's the top part of the heart versus the lower part of the heart. And then something has to be done. There are ways to chemically control the heart rate. Sometimes people have to have pacemakers installed to do so. Sometimes people have arrhythmia. They have to go in and burn the nerves that tell the heart to beat, because the heart is an electrical animal. There's a thing called the AB node that tells your heart to pump and beat. And sometimes it gets out of whack, basically. And they need to go in there and ablate that nerve. They can do that. And your heart has an innate normal rhythm that it will resume to when that's done. So there are lots of ways to do that. Sometimes chemical abnormalities like a low or a high potassium can do that as well. Too much sodium. But the vast majority of the time, it's not a pathological situation. It's just something that you become aware of. That was a great question, Keisha. Thank you so much. Don Ufut For children not eligible to be vaccinated, what are the vitamin dosage recommendations? Most kids can probably take vitamin D at 1,000 milligrams or international units, rather 1,000 international units daily. For a really small kid, 500. But for most kids that are, toddler and older, 1,000 would probably be okay. But you can get a recommendation from a place. You talk to a counselor at a place like the Vitamin Shop or GNC or someplace, or even your child's pediatrician, and ask them what they recommend. But I recommend the vitamin D, vitamin C, and zinc. Those three things will boost the immune system optimally and give your child the best option to avoid getting infected, or if they do get infected, to minimize how severe that infection is. So our objective is to, one, avoid infection. The way to do that is avoid exposure. So again, surround your children with people that have been vaccinated. If your child is going to school where they do not require masks, your child can still wear a mask. They're not going to take the mask from him or her, but it will be better if everybody was wearing masks and the exposure is there. If you get word that the rates at that school or in your area are going up, that somebody's passing it around, then you might have to consider taking your child out of school. They're already sending children home for 10 to 14 days in a lot of school systems right now. So if that happens, don't hesitate to do that. I know it's a child care nightmare. How can you work and with your kid home? It's a problem, but you need to have a plan in place. Don't wait until it happens, because I can assure you it's going to happen. This is going to get worse before it gets better as the weather changes and we start to move back indoors and to closed areas, but not decreasing the number of people there, not decreasing the crowds. We're going to see even higher numbers of infection. So there we go. All right. Makiba, hey, darling, how are you? Thank you so much. Can I get the flu shot while taking antibiotics? Of course you can. But if you're taking antibiotics, you might want to wait on whatever infection you're being treated for to get over. Let's say you have a sinusitis or bronchitis. That means you're sick. It's just not recommended that you get the flu shot while you're sick. So, but the answer to the question is yes, you could, but I just wouldn't recommend it. You can wait another week. Most antibiotic regimens or as little as 5 days and as long as 14 to 15 days. So basically you're a week away from being able to get the flu shot. So I would say don't mix things up. Why not give your body a chance to heal? Janine Scepter Houston, I have ulcerative colitis. Just want to know if I can do the lipo drops. Yes, you can, but you also probably need to do the probiotics and the lipo cleanse. That helps tremendously decrease the amount of inflammation. Ulcerative colitis, anything that has itis, such as appendicitis, diverticulitis, ulcerative colitis. Itis means inflammation of. So you want to take care and minimize the inflammation. So probiotics would help with that. Vitamin D is a natural anti-inflammatory as well. So your recommendation would be the trifecta that Dr. Collier recommends every day for everybody, every day. That's probiotics, the vitamin D, and omega-3 fish oil. Those three things will probably alter your symptomatology substantially and significantly. I have a lot of patients with this type of health problem, and I place more probiotics, and it is life-changing. Now, remember, this is in addition to, not instead of, whatever prescription medication you are on. There are a variety of new therapies. There's a drug that started off being an anti-arthritis drug, but it alters immune function, and ulcerative colitis can be an autoimmune variant. And so they noticed that a lot of people that were being treated for arthritis got marked improvement in their ulcerative colitis. So now that same drug is indicated for the treatment of ulcerative colitis. So you can Google that if you like. It is an injection. Phil Mickelson takes it for his arthritis. So something that you can do when you do that. But you can't take the lipo drops, which is what your question was. This is Ursula Clark Holmes. Why do you have to wait 90 days before you have to get vaccinated after you've had the COVID? You don't. When they said 90 days, they were saying that there was no scientific reason for that, in Dr. Collier's opinion. They were just saying that because there was a shortage of vaccine, and there were people who, once you have had it and recuperated from the coronavirus, you do have natural immunity. That is a true and scientific fact, that you have protection from the coronavirus, including the Delta variant in most cases. When you get vaccinated after that, you boost your immune response even greater. So I think that the thought process was they did not want to give vaccine to people that were already had established natural immunity because they got the disease and got over it, and they wanted to save the vaccine for individuals who had not got the disease and had not been infected when there was a shortage of vaccine. Well, now the vaccine is everywhere, so that's just that recommendation is not even being forwarded anymore. I have people that have the coronavirus, they get over it, and after they've gotten over it 2 weeks, I tell them they can get the vaccine. I recommend that they do. So there's no reason to wait for 90 days. That's just the way that's one of the recommendations that started. I told you what my theory is as to why it was there, but now that recommendation isn't even prevalent on the CDC website. Kimberly Williams, hello. If my A1C is 6.4, am I a good candidate for Wegovy? You are a great candidate for Wegovy because Wegovy is technically not indicated for individuals that have diabetes, which would mean an A1C of 6.5 or higher. So if you have a hemoglobin A1C of 6.4, that puts you in the pre-diabetic range. So you would be a great candidate for Wegovy. This is the new amazing weight loss medication that started off as a molecule utilized to treat diabetes, but people that were being treated for their diabetes were losing great amounts of weight. So people that were not diabetic were like, I would like to get some of that too because I would like to lose weight. And what they found out was they altered the molecule slightly, changed the dose recommendation, and now it's available for individuals who would like to lose weight. But the primary criteria is that you are not diabetic. If you are diabetic, you can go back to one of the other versions of the same molecule and still get it under your diabetes diagnosis, and your insurance company will probably cover it for you, and then you will lose the weight as well. So, but Wegovy is the now go-to. There is so much response to this product that they have an actual shortage of it. And they cannot manufacture it quickly enough, but it is a great thing to utilize for weight loss. I had a question, a patient asked, can I use the Wegovy as well as the lipo product? Yes, you can. They're perfectly compatible. You can use them together without problem. So we don't when that question comes up, I tell people you can do both and optimize your metabolism because you want to do that. And then the Wegovy, which will make you lose weight by altering the way your body digest food and the calories associated with that food. So for those individuals that are listening, they say, what is this Wegovy? Google it, find out about it, and you'll see that this is, again, one of the great ways to lose weight that's available out there, as well as the Lipo line products. Go to the website, www.lipodrops.com, and find out how you can lose weight utilizing the entire Lipo line. And you'll find out when you do the weight loss assessment, what the recommendation is for you, which product should you take. And the question and the answer is, how much do you want to lose? Number one. Number two, how quickly you'd like to lose it. Number three, how much and how financial the investment will be, because as you add more products to your treatment regimen, you lose more weight, you lose it quicker, but it costs you more. So you'll have to make that determination yourself. Great question, Kimberly. Thank you so much for tuning in. B. Dukes, what I suggest for debilitating pain from fibromyalgia? Well, there are a couple of products that have now gotten the indication for that. Cymbalta, which is technically an antidepressant, but CBD oil has found to be a lifesaver for patients suffering from fibromyalgia pain. So CBD oil or just outright use of marijuana, which is legal in more than half the states in the United States right now. But I tell people you have to take into consideration, if you're in an area where it's not legal, the consequences of doing that, particularly if your job may require drug screens, etc. But and also if you smoke marijuana, people can smell it on you. So that is an immediate social turnoff if people don't care for marijuana sense or smell. But there are edibles, there are gummies, there are other products that are available, but you can get the same benefit from CBD oil, which does not contain high enough quantities of THC, which is the component that gives you the buzz and the high with marijuana, but it has the other nerve blunting and pain stimulating blockage that gives you the benefit. And so CBD oil works. It is amazing. You just have to make sure that you get a dose that is potent enough to give you symptomatic relief. There is no dose that's too high. The question becomes, what is the dose that is effective? And products that are out there now, there are 100 different versions of CBD oil with as little as 200 milligrams per meal to as much as 5,000 milligrams per meal. So you have to determine what dose you take and which one to be most effective. CBD oil is very effective for fibromyalgia pain, anxiety, depression, muscle aches, anxiety, insomnia, almost so many different things that people suffer from. They get benefit from naturally treating themselves with CBD oil. So it's one of those things that I highly recommend, and one of those things that we're going to have a lipo CBD product available soon. We're working on again, just those things, the dosage that would be most appropriate for most people and the problems that they have. And again, just one of those things that's natural. God's put everything on this earth that we need. We just have to find it and know how to utilize it. And that's where we are with that. Great question. Thank you, Tamika. Okay. Should you get the booster if you have high blood pressure, asthma, and you're diabetic? Well, if you got the Moderna, you don't need to get a booster. It's going to be you're going to be covered anyway, at least at this time. If you have the Pfizer, you can decide to get a booster or not. The Johnson & Johnson is not offering boosters at this point. So those are your options. The Moderna also has not applied for booster shot status. So the only one that is available at this time is the Pfizer version, although people are going into places and asking for boosters and they're getting them. I've had my first patient that got pushback who has exactly that combination: high blood pressure, asthma, diabetic. They also had high cholesterol. And so this is an African-American male with those three risk factors and overweight, everything that puts them in the highest risk category, the first being African-American male. There should have been no hesitation to give them a booster. After I referred them to it, I sent them back with a prescription for the booster, and I think it was administered, but they still sent me screenshots of CDC criteria for getting boosters, which mean absolutely nothing. Those are just recommendations. They are not guidelines and not requirements, and you don't have to follow that. Fortunately, a healthcare provider can utilize their own common sense training, experience, etc., to make recommendations that may be, quote, off-label or not necessarily in the guidelines. But guidelines are just that. They are suggestions. They're not the only way or necessarily even the proper way sometimes to do things. All right. So great question, Tamika. Lakita Bass Hall: can a person who's had reactions to a fish, not just shellfish, take the COVID vaccine? Yes, there's no cross reactivity between the COVID vaccine and people with fish allergies. However, omega-3 fish oil is one of the things that you might have to be concerned about if you are allergic to fish and had reaction to fish. But no cross reactivity. There would be a whole lot of people who couldn't take the COVID vaccine if there was reactions to cross reactivity to people with fish allergies. As a matter of fact, people that have a lot of allergies, there doesn't seem to be a higher incidence of allergic reactions in people that have known allergic reactions to a variety of different things when they're getting any of the coronavirus vaccines, because there's just nothing in there that should cause that. So again, I caution my patients that have a history of allergy to take a non-sedating antihistamine, Zylol, Zyrtec, Allegra, or Claritin, and an anti-inflammatory such as Motrin, Advil, or Aleve. Take those things, start the day before you get the shot and continue taking that medication for the next 2 days. That will minimize your chance of having an allergic reaction or any side effects, including even a sore arm, just by doing that. And it does not impact your body's immune response. You will still have the same immune response. There was a question at first whether you can take Motrin and then take the shot, and they were saying no, you shouldn't, only take Tylenol. Then they found out that just was not true. So now the recommendation, because Motrin and Advil and Aleve are anti-inflammatories, they help with inflammation. The problem with the vast majority of the side effects are inflammation. Tylenol is just a pain pill. It will relieve pain, but it won't stop inflammation. So vitamin D, again, a natural anti-inflammatory, will also help. So get your vitamin D levels up. Take your vitamin D and your zinc, regardless of where you are in your immune status situation, vaccinated, unvaccinated, sick, healthy, whatever. That boosts your immune system no matter what. It just makes you a better you and make you able to fight off a variety of infections, bacterial, fungal, and viral, just by boosting your immune system. So vitamin D at 5,000 international units per day, vitamin C at 1,000 milligrams per day, and zinc at 30 to 50 milligrams, depending upon your size and how you tolerate it. So that is the boost in your immune system. There are other things that can do it as well. Elderberry extract is phenomenal at boosting. Black seed oil, boost your immune system as well. Several other products that you all know and love and are utilizing. But the big three: vitamin D, vitamin C, and zinc to boost your immune system. Should we? Oh, okay. So Marlene Kennedy, Labradio. So we should get the flu vaccine, which I always do, but not the booster shot this time. I got the Pfizer vaccine in January. Um, yes, is the answer to your question. You should get the flu vaccine now, and if you're eligible to get the Pfizer, you're in the month. They said 8 months out, but they still have not actually opened up the option for getting the booster shots. Although if you call your local drugstore, chances are you'll be able to go in there and just walk in and get the booster shot. Nobody's turning people away, except for the first time I had that happen to a patient today. So you know, if you have the option right now, if you want to get the booster, go ahead and get the booster, because we're just getting into the flu season. And so you got a few weeks before it's really going to be an issue. So right now, while it's still warm outside, I would get the booster and then get the flu vaccine, say toward the latter portion of September. That would be my recommendation. But you can't go wrong doing it either way. You can get your flu vaccine now as well, and then toward the latter portion, because there's no fixed period. You're eligible for the booster, they say, at 8 months out. But anytime after that, you can get the booster. There's no downside to getting it at 10 months, 12 months, whatever you want to do, they're getting the booster. So you can do that as well. Great question, Marlene. I really appreciate that. Okay, Jeremy Mitchell says, is the gym safe if I'm vaccinated? No, no place is safe. Let's be clear on that. If you're in an enclosed space, and you're around other people inside the gym, people are working out, they're breathing extraordinarily hard, they're blowing out. If they're infected, then they can infect you. But if you've been vaccinated, chances of you getting infected are very, very slim, in particular if you wear a mask when you're in close contact. But your question was, your exact wording was, is the gym safe? And Dr. Collier is saying no place is safe. Let's be clear. But the gym, if you want to go to the gym, I'd try to work out when the gym has fewer number of people in it. And a lot of gyms now have, they've increased the amount of circulation in the air, and they're using UV lights to kill virus in the air. And a lot of things have been put in place because they know that the gym is a place where you could pass the infections pretty readily. So check with your facility and ask them what protocols and safety things they have implemented to decrease the chance of passing the coronavirus. You may be surprised, particularly with this new type of UV light and the way that they have this the air circulating and everything from infusions. And I recommend in diffusers, you can put just water and a few drops of lavender in there, lavender oil. So these oils are very effective in killing bacteria, fungi, and viruses. And so I have diffusers throughout my office with lavender in them to decrease the amount of any infectious agent that's just in the air. So something to do. So great question, Jeremy. Appreciate you tuning in. Melissa Sullivan Alley, currently waiting to be tested for an autoimmune disease. They said it could be years to find out what it is. Does this put me more at risk? It puts you at risk, but autoimmune diseases are overdiagnosed, in my opinion. Oftentimes people are given a diagnosis of things like lupus and MS, which isn't autoimmune, but it's an immune system disease process, because there is no test for those disease processes. There are tests that more likely rule out other things, and the vast majority of the time, those disease states are a diagnosis of exclusion, which means we haven't found out what it is, so we're going to call it this, which is an autoimmune disease. The thing is that most autoimmune diseases are treated the same way, predominantly with steroids to mute the immune response. There are now targeted drugs that can alter the immune response, such as the injectable that I talked about earlier. But try to get to the end of this, and they may not ever find out. Get a second opinion, find out what it is, but don't accept the label of an autoimmune disease, particularly if you're middle-aged and you've not had problems like this earlier in life. For you to all of a sudden have an autoimmune disease, I mean, it does happen, but it's highly unusual. And oftentimes, with the way medicine works these days, if I refer you to a doctor that's an immunologist or a rheumatologist to determine if you have an autoimmune disease, and they say, why are you sending this patient? I say, because I'm trying to rule out an autoimmune disease, then that's what they're looking for. And they're not necessarily open-minded to other possible diagnoses. So I try not to focus my referral source on that particular thing. I may just describe the symptoms and say evaluate and treat. And that way the doctor isn't already going down a pathway that I'm directing them down. I'd much rather that the doctor utilize their own expertise and come to a diagnosis on their own. They may come to the same diagnosis, but if I tell them, look for this, then that's what they're going to look for. And if they don't find it, they may stop looking. And so it's a complicated issue in the healthcare system. And so, and once you start going down a pathway, people keep pushing you down that pathway, even though it may not be the right path for you. So form a partnership, talk to your doctor, let your primary care doctor be the quarterback in this situation, because you need somebody that's looking out for your best interest. And then communicate with those doctors. Do not let them run you in and out of there in 10 minutes and tell you we're going to do labs, because that's how you get misdiagnosed. Sometimes the patient will tell you what's wrong with them, and you can make a diagnosis based strictly on the patient's history, but you have to listen to the patient's history. And if the average medical visit, believe it or not, is 7 minutes in length. And the doctor usually cuts the patient off in less than 2 minutes once the patient starts talking. So you have to take control of that, not in an adversarial way, but tell the doctor to sit down, put his computer down, put his laptop down, look you eye to eye at the same level that you are, and let's talk about what's going on with me so we can get to the bottom of it together. That's the best way, and that's the most effective way to get your health care. Don't let this medical machine that we have now developed into get you 100 referrals and 1,000 scans of this nature, MRI, CT scans, ultrasounds, that don't make a determination as to what your diagnosis is. My primary recommendation is never do a test, and I never perform a test that's not going to change how I'm going to treat a patient, regardless of the results of that test. So I don't order unnecessary MRIs or CT scans, because people ask for them all the time. And I tell them, guess what? You have back pain. I send you for an MRI. When you come out, you're still going to have back pain. It doesn't change anything. I may call what you're having something different, but to you, it's still back pain. And I'm going to treat it exactly the way that I'm treating it, unless there's a reason to do it. If I think it is a surgical problem, then I'll send you for a scan. If I think that's something that can be done in an acute intervention, or I'm not treating it because I'm not sure what I'm treating, then I may do a scan. But but before they had all this high-tech technology, doctors had common sense, that they would make diagnosis based on a thorough and complete physical examination, and by talking to the patient. And believe it or not, they make the diagnosis correct the vast majority of the time. So good luck, Melissa. We hope that everything works out for you. Billy Sue Combs, why would I have to have a gastro appointment if I've been told that I'm anemic? Because they want to make sure that you are not bleeding from your stomach or your intestines. That is the most common sites of bleeding. Oftentimes, if you're bleeding from your stomach digests the blood, so it does not look like blood in the stool. But that is literally the go-to place if you have anemia, unless there's another reason. And the most common reason in a woman of childbearing age is heavy menstrual cycles due to fibroids. So that would be the first option. If you still have a uterus, I would get an evaluation from my GYN first, and then but a colonoscopy is standard ops for a person that has anemia, because anemia in an adult is abnormal 100% of the time. There may be a reason for it, again, like heavy menstrual flow, and it's just a matter of replacing the blood. But oftentimes the body cannot replace the blood if you're having a menstrual cycle that lasts more than 5 days and you're going through 5 or 6 heavy pads a day. Then you're bleeding too much. And some people, they bleed for 2-3 weeks at a time. So that's the most common thing. But GI is the next most common option. And so that's why they're probably going to do an upper GI scan going down your throat, or an upper endoscopy, as well as a colonoscopy, to look for a source of bleeding with that. So that's the answer to your question, Billy Sue. Things should work out for you. Look healthy. I don't think it's going to be a problem. If a person is anemic and has difficulty taking iron, what would be a substitute? Well, B-Dukes. That could be a actual iron transfusion. They're doing that now. There are also injections and medications that a person can take that will make their body make more blood itself. And then there's also blood transfusion. So it just depends on where you are in your state of anemia. But oral iron is the go-to. There are various preparations that you should try if you just cannot tolerate, no matter what. And the most simple solution is that when a person takes iron, they're not taking enough water when they take it. They just take a sip of water. They melt the tablet. The tablet becomes a thick and chewy gum on their stomach, and it's highly irritating, makes you nauseated, and a variety of other things. Iron can also constipate you. So very important that you do that. You take enough water when you take the iron, and then you also make sure that you can take it mid-meal. Start eating, take the iron tablet, a full glass of water, finish eating, and you probably ought to be able to tolerate it that way. It's not difficult. Kathy Londa said, I recently found out that I have an underactive thyroid and I'm taking a low dose medication. Would I be considered at risk? No higher blood pressure or diabetes. I had stopped taking. Don't know why you had to stop taking the elderberry. That's not related to thyroid disease that I'm aware of. Thyroid is the most underdiagnosed and undertreated disease state that there is. The leap is to take medication or not to take medication. So if you're taking a medication, make sure you're taking a therapeutic dose. You state specifically that you're taking a low dose of medication, and you don't want a low dose, you want a therapeutic dose, and that dose depends. With thyroid and other hormones in your body, there's a range of normal. So let's say this is low and this is high, and everything between my hands is normal. You don't want to be down here on the low end. At the worst case scenario, you want to be in the middle. At the best case scenario, you want to be on the other end, on the high side of normal, so that your thyroid is operating optimally. Your thyroid is your master gland. It is your body's thermostat. It is responsible for how your body fat, your metabolism, how alert and functional you are. So you don't want to take low doses of that. You want to take therapeutic doses of that. And the type of thyroid replacement that you take. Go online, do some research on thyroid disease states and find out, because the most common thyroid replacement is a synthetic thyroid hormone called Synthroid. And it does work, but there are much better options for treating. There's a thing called Nature Throid. There's a thing called Armor, because thyroid has two versions. There's T4 and T3. T4 has to be converted to T3, which is the active thyroid hormone. Some medications are strictly T4, and some people convert this very effectively. Some people don't convert it well at all. So they can take T4 and never get enough T3, which is what they really need when they're treating the thyroid. So you can take the thyroid T3 directly and cut out the middleman, and that way it doesn't matter how you metabolize it or not. And then there are products that are a mixture of T4 and T3, so that you get enough T3 regardless of whether the T4 is converted effectively or not. So this requires a doctor that has some working knowledge of thyroid versus a casual knowledge of thyroid. But thyroid is the most undertreated disease process, and most people that are getting thyroid replacement are not being treated adequately. They are being treated, but they're not being treated with a therapeutic dose. They're being treated with a dose, and you need the dose that's going to get you at minimum to the middle and optimally to the high side of normal, so that you can get maximum benefit from that. Okay, make sure you work with your doctor. Anita Jr., hello from Mississippi. What are vitamin K for? Vitamin K is one of the vitamins that works very well with vitamin D as well. But vitamin K itself can decrease your body's ability to clot. Blood clots won't form, so you get a cut, or you start bleeding from your stomach or your colon, and you're going to keep bleeding. So vitamin K can be dangerous in that circumstance. If you're taking a blood thinner, such as Plavix or Eliquis, or one of those products for palpitations or atrial fibrillation, or you've had blood clots like deep vein thrombosis, you cannot take vitamin K. If you're going to have surgery, stop taking vitamin K. But if you're a normal, regular person, you have normal functioning clotting abilities, then vitamin K is good. It helps tremendously with a variety of things, particularly when partnered with vitamin D3. So again, one of those things I recommend, but with the caveats that, and reasons that you wouldn't take it would be that you're on blood thinners or you have problems with prolonged bleeding. All right, great question. Okay, also, is Instaflex cream good for arthritis? Instaflex cream is not a product that I'm familiar with. If it has anti-inflammatory capabilities, then yes, it's good for arthritis. Natural other things that are good for arthritis are red pepper, or curcumin, or turmeric. All are natural spices that you have in food, but you can take it in capsules, you can take it, drink it as a tea, and all of these things are good for arthritis. And there are two types of arthritis we need to clarify. Remember I said earlier, itis means inflammation of, artho means joint. So arthritis means inflammation of your joints. The two broad categories are osteoarthritis, which are basically degenerative joint disease when your body starts to wear joints out. Basically the aging process. And then there's rheumatoid arthritis, which is an autoimmune disease where the joints are literally being attacked by antibodies, and there's major damage being done to the joints, and you get joint deformities, and your fingers start to gnarl up, and you get loss of range of motion, etc. So ways to determine that. Most of the 80 to 90% of people, if you live long enough, you're going to have osteoarthritis, which is the degenerative joint disease basically associated with aging. Anti-inflammatories help with that. There's a compound called glucosamine, and in combination particularly with another compound called chondroitin, that will actually heal your joints. And this is natural. This is all natural and doesn't require a prescription. A name brand is Osteo-Biflex, but there are many name brands, and you go to that section in the pharmacy or the drugstore or the grocery store, you're going to see 10 different options, including the store brands. That is one of the few things that's actually been shown to heal joints over time versus just decreasing the inflammation. All of the anti-inflammatory prescription drugs just help with the pain and slow the progression down of arthritis. They do not cure it. They do not cure it. Some of these natural products have been shown to literally cure particularly osteoarthritis. But osteoarthritis is associated with being overweight because your joints, the most common is the knees and the hips, just wear out from carrying around a large load. So you need to make sure that you at or near your ideal body weight to help with arthritis as well. With rheumatoid arthritis, again, there are major new biological products that shut down the immune response and stop really the disease from progressing and do promote a lot of healing. So those are the treatments of choice now for people with rheumatoid arthritis. And the thing, a lot of the things that you've been hearing about that were utilized earlier to treat the coronavirus have a place to treat rheumatoid arthritis. And that recommendation is being given. I have a patient today that was seen by the rheumatologist, and they started them on that particular product for their arthritis. So we are out there. There are treatments available, but you have to work with your doctor. It is a process. It is not a go in, get the diagnosis, get one prescription, you're going to be cured. Both of those arthritises are chronic diseases that need to be managed. And managed appropriately. It can make a major difference in what your lifestyle is going to be as you age. All right. CMOS for your immune system. Winnie King, thank you so much. Dr. Collier, and those who have listened to me for years have heard me talk about CMOS. It is a major benefit to not just immune system, but digestion as well, and arthritises and things like that. CMOS has just been a major good supplement to take. And so a lot of people take it routinely. Again, I do endorse it, recommend it. I think CMOS is a great product, but with any supplement, you have to make sure that there's quality controls with the manufacturer, that you're actually getting what you're supposed to get. And so again, go with somebody that's trusted, a name brand you may know and like. Some of the larger stores like Costco and BJ's and Sam's, they have their own in-house brands of supplements that include CMOS. So you can find these things available, and you can trust those things usually from those manufacturers. But again, to answer questions, yes, I like CMOS to boost your immune system. I think it's one of those things that will do it. It does not boost as well as vitamin D at the 5,000 milligram dose, or either things like elderberry extract. But again, this is an addition to, not instead of. You can't have, in my opinion, too many things to boost your immune system. If that's one of the things you like to take, I would take it. But I would start off, my first choice and go to is always vitamin D. Vitamin D, 5,000 international units per day. Thank you, Winnie. Great question. Okay, Ms. Webb Senior. If I take a LipoDrop supplement, is that all the supplements I need? Well, it depends on which supplement you're taking and why you're taking it. So the three things that Dr. Collier recommends on a daily basis is omega-3 fish oil, vitamin D, and probiotics. Those three supplements are great supplements. They do not meet every need that your body has. There are other supplements that you probably can take and would take if you're trying to lose the weight. The LipoDrops Max, of course, is the first product in the weight loss line, but there are other things as well that you can take. So if you go to the website, lipodrops.com, it will give you more information, and you can make a decision based on the information, the things that you read, and the recommendations that are there. Thank you. Wanda Monette, does the vaccine work with the new Mu variant? Okay, somebody has found that he's been doing their reading. Also, once you're vaccinated, does it wear off over time? I do not think that the vaccine wears off over time. I think that it gives you possibly even lifelong immunity. I told you initially when they were talking about the vaccine, they had already determined that it should be good for up to 36 months. They started announcing that it was good for 3 months, then 6 months, then 8 months. Only because the time has come and gone and they have shown that the efficacy maintains itself. So at this point, I don't think that the vaccine wears off over time. We might be in a position where we'll need boosters. I think that targeted boosters and Pfizer and Moderna and Johnson & Johnson are all working on vaccines that are more targeted toward the Delta variant and this new Mu variant. Right now, almost 100% of cases that you're seeing now are Delta variant. Literally, it's like 99.8%. So there's just no place for the Mu variant to grow because two things cannot occupy the same space at the same time, a basic law of physics. But the Mu variant is one that is, it has more alterations than the Delta variant. Delta variant has 4 deviations from the standard alpha coronavirus variants. So the Mu variant, I think, has 9 variations. So it is possible that it could be easier to get around the immunization process. That has not shown to be the case at this point. So Wanda, thank you so much. That was a great question. We're going to close it out right there. So thank you for tuning in. Thank you, Antonio, for being the man with the plan, the producer of this fine presentation, the Your Health is Important radio broadcast and Facebook Live broadcast, brought to you the 2nd and 4th Wednesdays of every month to answer your healthcare questions. So we're going to close it out right now. And I want to once again thank everybody for coming in, spending your afternoon with me. We appreciate you so much. As we go out within the stone, Earth, Wind, and Fire, my favorite song, and Dr. Collier's theme song. Whenever he's making a presentation or public appearance, we want you to know when you hear that, you're about to listen to Dr. M.J. Collier. Thank you so much for tuning in. Go on and do those things you need to do now. Eat your dinner. Enjoy your families. We'll see you next time, the 2nd and 4th Wednesdays, 6:30 every month. Your health is important. Live on Facebook with Dr. M.J. Collier, your family physician. Thank you so much.